Once again, we're tackling a very, very controversial and taboo subject today, but I believe, and many people believe, that this topic is of very, very big importance, especially within Britain, within England, and to not talk about it, I believe, would be a big disservice. So I'd like to thank the person, I'm not going to name the name, but a person got in contact with me and suggested I would look into this just a little bit further. And the results from us having an interaction via email and me submitting these FOI requests, I've now uncovered something that I thought, it's shocking, to say the least. So this investigation explores the cost and patient burden of genetic disorders linked to cousin marriage, known medically as consanguinity, within the UK's National Health Service, or NHS. This is through targeted freedom of information requests, where I examined the extent of this issue in technically three, because I'm still waiting for another NHS Trust to reply to me, but this was so serious that I thought I need to get this out before someone or another person or another organization or whoever decides to steal it and not credit me, because this seems to happen a lot. It's very, very annoying. And it's looking at technically three of the most affected regions of this problem, and that is Bradford and Birmingham, and the other one being Luton. So why Bradford, Birmingham and Luton? Now, I chose these for a very specific reason, and that's both cities have large populations with high rates of cousin marriage. And this is particular in the Pakistani and Bangladeshi communities, where consanguineous unions are very, very common. This isn't me trying to be hateful. I'm not trying to tar anyone with a particular brush. This is based on previous studies by the NHS and by people from these communities pointing it out. I am merely finding more data and regurgitating it to you. Now, I can already hear the screaming and the shouting through phones, through wherever you're watching this on, I don't know, a laptop or a computer or whatever, saying, well, what about the aristocratic elite? What about the royal family? I agree. It's wrong. It's super wrong. And this practice has been widely condemned as a public health issue. And I don't believe, correct me if I'm wrong, it is being practiced now. And if it is, it should be banned completely. A blanket ban. Nobody, doesn't matter what community, what culture it is, nobody should be engaging in this practice, in my opinion, because it harms children. I want to get that out of the way, because I know a lot of people are trying to pigeonhole others just because you're repeating statistics or you're mentioning particular communities who have a common practice within certain cultures or whatever. This wasn't about randomly selecting NHS Trusts. It was targeting specific areas where the risk is statistically known to be higher. That's it. And this is all based, like I said, on past medical literature and public health research. Past studies include those from the Born in Bradford research project, where they've highlighted a strong correlation between cousin marriage and the increased prevalence of recessive genetic disorders in children. And this FOI aimed to quantify that burden on the health service. So what did I ask? So under the Freedom of Information Act, I asked for both trusts, or all three. I requested, number one, the number of patients diagnosed with severe genetic disorders attributable to consanguinity, for example, cousin marriage, from January 2020 to the present. Number two, a breakdown of costs incurred by the trust in treating those patients, including inpatient care, outpatient services, and long-term community support. And number three, any internal reports, reviews, or assessments discussing the healthcare burden or clinical planning required to deal with these conditions. So let's start with Birmingham. So Birmingham Women's and Children's NHS Foundation Trust showed and revealed to me that the total patients identified between 2020 to June 2025 was 1,559 individuals. And the cost of care, which is extremely alarming, it's more than £3.8 million over the past 5 years. And the breakdown is here. For 2020 and 21, it was 219,000 for that year. For 21 to 22, 630,000. And then in 22 to 23, it rose to 1.1 million. Unbelievable. Then 23 to 24, 953,000. And 24 to 25 was 731,000. These are real figures. These, as you can see, are taken straight from the NHS response. And this is publicly funded NHS resources being used to treat inherited disorders linked to consanguinity. The Trust does not hold any internal reviews on the burden or clinical strategy, which is a worrying omission given the scale. I asked Bradford's Teaching Hospitals NHS Foundation Trust, and what they revealed was they were unable to provide patient numbers. Despite me managing to get that from Birmingham's, the coding system used cannot differentiate genetic disorders by cause. Identifying relevant cases would require manual review of all patient records, which exceeds the cost/time limits under the FOIA. There's no cost data available, according to them. No internal reports or assessments are held. But they did, however, point me towards assessments that are held, such as the Born in Bradford study on genetic conditions and consanguinity. Interesting, even though they don't hold the information now. Cousin marriage was once practiced among certain aristocratic or rural families in Britain. There's no secret to that. We all know that. But it's now widely recognised as a public health risk. As I said earlier, it's wrong. It shouldn't be happening. Whatever community, whatever culture, like I've said. But when practiced systematically, especially across multiple generations, the chance of a serious inherited disorders, such as metabolic or neurological diseases, increases dramatically. And the NHS was not designed to quietly absorb this cost of culturally specific genetic risk factors. We're talking about over 3.6 million in a single city. And that's just the cost where the data was available. There are other things that are a massive concern as well, such as the NHS does not currently publish a national audit of the cost burden of consanguinity linked disorders. Very, very troubling. These conditions often require lifelong care. This isn't a brief thing that just happens and then goes away. It is lifelong. So you continue to pay for this, such as specialist treatments and community services. Lots and lots of money to be added on top. Public health professionals have also called for greater awareness and screening in the past, but it has remained a taboo topic, especially in political and media circles, because they believe it's some sort of cultural sensitivity. Well, I'm sorry. I hope that this data forces the uncomfortable questions. This is my opinion. I don't care about cultural sensitivity anymore. I think we're past that now. If something is affecting children, especially their health, and this practice such as this shouldn't be happening anymore. But if it's being screened and hidden and it's still considered taboo for cultural reasons, I think that's a problem. I think that's a massive problem and a cope. As I said, I'm still waiting for Luton to get back to me on their figures, and I'm following up with more emails and more questions into this subject because it is undeniably a very, very tricky and sensitive, but also a very important one to be discussing, especially in 2025. This is one trust, like I've said, that have given these shocking set of numbers. Another trust, Bradford, had no figures at all. No review, strategy, no risk assessments, nothing. Nothing. Complete stonewall. This issue is still remaining cloaked, let's say, in complete silence, despite the mounting public costs and even pressure now within Parliament, where some MPs are trying to tackle this. I know a particular Tory MP tried to push through a ban on cousin marriage, and it was shot down by Labour. I believe Guido Fawkes were reporting on this particular issue as well. The thing is, it's human suffering. So quite frankly, I don't care about cultural sensitivity. I care about kids. I care about what they are going through, actually. So hopefully this helps with anyone who is more of an expert in this area of field and knows more about the science around this and requires more data regarding the number crunch. This is as much as I could get so far, but hopefully in the future we'll be able to have more transparency, although it's very unlikely considering this government and its predecessors. But stay tuned because there is more data to be dropped at a later date. Thank you very much for watching. If you would like to see more about the data and to see it up close and you can read it for yourself, you can head to my Substack where you'll find the article with this video in there. If you're watching this on Twitter or X, YouTube, you can find the link to it. But please go to my Substack. You can read it for yourself. Don't take my word for it. Thank you very much. And I'll see you again very, very soon.